Healing with a sex therapist. A sex therapist is a licensed professional who can help with the psychological characteristics of sex-related concerns. There are 4 categories to sexual dysfunction that can occur in the sexual cycle. Desire. This is the lack of libido, meaning there is no interest in sex or intimacy. Arousal. The body is not responding to stimulation. For women, this can mean the vagina is not getting wet, or for men, the penis is not able to get or stay erect. It's also important to mention that no matter the age of the man, it is common to lose an erection based on hydration, nervousness, anxiety, stress, environment, and is not an immediate indicator that the male is not interested in playing. This is where exploring other sensual and kinky plays can come in handy. Viagra and other similar medications are also used by men who commonly experience erectile dysfunction. There are also some medications for women. Women, depending on their hormonal cycle, may be more or less wet as well. Both sexes can experience side effects of different medications or getting older. Vaginal dryness and vaginal atrophy can occur and is not based on age. Orgasms. Too soon or not at all. For men, this can be premature ejaculation, no ejaculation, or delayed ejaculation. For women, they are sometimes not able to achieve an orgasm. Pain. Pain with sexual activity can be experienced by both men and women, but it is more common in women. Embracing for the pain can cause a person to not be able to enjoy sex, thus avoiding it. Sex therapists also help with anxiety, fear, or shame related to sex, sexual trauma, porn addiction, sex addiction, coping with and living with STIs, poor body image and its relation to sex, gender identity and/or sexual orientation, cultural, religious, or societal views of sex, sex and intimacy communication for partners, mismatched sexual desire between partners, relationship issues stemming from sexual difficulties, sex education, correcting miseducation, and education on the use of toys. A sex therapist can help with these situations and help address through therapy to find a remedy. It is also important to work with your primary care doctor to verify there are no underlying conditions. Here are some of the treatment methods. Cognitive behavior therapy. This is goal-oriented type talk therapy used for mental health conditions such as depression, anxiety, emotional concerns as well, which may be related to coping with stress or grief. CBT is used to help those with these conditions that can be correlated with their sex and kink struggles. In mindfulness therapy, one becomes more aware of their physical, mental, and emotional condition in the present moment without becoming judgmental of themselves. The focus is leading the bodily sensations, cognitions, and feelings, and to accept them without being influenced by them and not be controlled. Emotion-focused therapy is defined as a practice of therapy informed by an understanding of the role of emotions in psychotherapeutic change. The goal is to create strategies promoting awareness, acceptance, expression, utilization, regulation, and transformation of emotions with corrective emotional experience. The hope of EFT is strengthening self-regulation effect and creating new meaning. Finally, couples communication technique. This is a practice of communication that is verbal, nonverbal, and written for couples.